Respiratory system, it has some conducting organs or tubes and have some organs. So respiratory system starts by the nose, so that it's your nose. The nose has a floor, which at the same time this is the roof of your mouth cavity. This is called the palate. Palate has its anterior two-thirds as the hard palate, it's bony. Posterior one-third is a soft palate and is ending by this finger-like projection called uvula. Function of the uvula, shutting off the nasal cavity from the mouth cavity during swallowing or eating. Okay? When you study the lateral wall of your nose, the lateral wall of your nose has three bony projections. Their names are conchae. So that is the superior concha, that is the middle concha, that is the inferior concha. Below each, we have a shallow depression. Each is going to be named meatus. So here is the superior meatus, this is the middle meatus, this is the inferior meatus. These for the openings of the paranasal sinuses. What are the paranasal sinuses? These are cavities that nearby your nose. They are four in number. Here is the frontal sinus. Here is the ethmoidal and sphenoidal, and then we have the maxillary sinus in your upper jaw. Okay, they have their openings in these meatuses we just mentioned. They are empty rooms to make the weight of the skull lighter and to make resonance of your voice and to make warming of the air you inhale. Next to the nose, we have the pharynx. The pharynx is divided into three parts. The part of the pharynx opposite your nose is called nasopharynx. The part of the pharynx opposite your mouth is called oropharynx. The part of the pharynx opposite your larynx is called laryngopharynx. Okay? And then we go to the larynx. Larynx, we use the other mannequin. Larynx is made by 8 cartilages. These 8 cartilages would like to know just 3 names only. First of all, this is the hyoid bone. It's not a cartilage, it's a bone. It has horns. This is the small horn, the lesser horn, and this is the greater horn or the large one. Attached to the hyoid bone is the most back of your tongue muscles attached to it. This is called the epiglottic membrane, containing the epiglottis anteriorly, which is this that will cover the respiratory passages, the larynx, while food is passing down the esophagus. So no food is allowed to be entered into the trachea. And then this is the thyroid cartilage or Adam's apple, and then lower down to it we have the cricoid cartilage. It has so many small muscles attached to it, and it contains inside it this thyroid cartilage the vocal cords that are inverted V shape when they are acting inside. Next to the larynx we have the trachea. As you see the trachea, half of it in your neck and the other half in the abdomen. We'll see this in the other mannequin. The trachea is open all time by these tracheal rings. These tracheal rings are incomplete cartilages or C-shaped cartilages. Anterior to the trachea, by the middle, this is the thyroid gland. It's made of 2 lobes, one lobe here, one lobe there, attached by the middle by what's called isthmus, which is opposite the second, the third, and the fourth tracheal rings. Okay? Let's see the other mannequin. This is again a quick review. Here is the hyoid bone, the most top, and then epiglottic membrane, and then thyroid cartilage or Adam's apple, and then cricoid cartilage, and then this is the trachea. As you see, half of the trachea in the neck, the other half inside the thoracic cavity. Going lower down, these are the 2 lungs The right lung has three lobes, upper, middle, and lower. Left lung has two lobes only, upper and lower. Why? The heart is taking this area for the chambers of the heart. If you remove these coverings for the lungs like that, we can follow up the divisions of the trachea. Trachea, as you see back to it, this is the esophagus. Why it's open by these C-shaped cartilages? To make easy passage of food in this esophagus going down the stomach. Okay, now the trachea is going to divide into two primary bronchi. The two primary bronchi will divide into secondary bronchi. They are three on the right side and they are two on the left side. And then more divisions into smaller and smaller bronchi will go into tertiary bronchi, and then finally will divide into smaller bronchioles. At the most end, we have these alveolar sacs or small balloons where gas exchange can take place in these things. Below the two lungs, we have this is the main muscle of respiration. This is the diaphragm, as you see, it's made of two lobes like that. That lies between thorax and the abdomen. Thank you.